Okay, Reagan Archibald back for video number 3. And this will give you the insights on some of the novel treatments that we'll do to enhance the healing properties in your joints. Now, some of these may be where we use the 361 products that are tissue based. So we use umbilical cord tissue. This matrix can allow for better cushioning in your joints. The other thing we do is PRP. So this is platelet rich plasma that's been shown to be like fertilizer for the joints. And then ozone. So you guys know how good oxygen is for you. Well, imagine getting oxygenation right into the joint, right into the area you have pain. Well, that's going to help your body heal much quicker. So these are some of the treatments that we'll do in our pain reversal program. So when you come in, this is what one of our patients, Gail, said. She said, I came to the clinic to address the osteoarthritis of my hip. I could not be more pleased with the care I had. My treatment included various approaches. This integrated approach to health treatment blends the best of traditional Western medicine with proven Eastern practices. And so Gail is just an amazing patient because she actually did the work. She ran her labs, she got the right treatments, and now she's back to health independence. And so what we want to see is some new growth in your cartilage, new growth in the ligaments, healthy spine. That's what we get as a result here. But what we do as a team is we'll take you through and we'll write up your program design. So this particular patient wanted to build muscle, lose fat, and get rid of back pain. So the pathways we wanted to open up are, number one, remove the inflammation. That's phase 1. Phase 2 is repair the damage. And then phase 3 is the regenerate and remodel phases. We took them through and we did the right tests. We got images, x-rays, MRIs. We did blood tests, stool, saliva. We did that twice per year. We did peptides, like I mentioned in the last video, the allografts, the acu, the physical therapy, chiro, gua sha, trigger point injections, ozone, PRP, and then we got him enrolled with health coaching and in our health accelerator course. So what he noticed is the phase 1, the first 3 months, all the inflammation was gone. He was out of pain. He was feeling great with the Regen Med and the peptides. Phase 2, that's when we started working more on the posture and getting him on different types of peptides to help him build muscle. Phase 3 was the regenerative phase, and this is where we did more of the growth hormone peptides. We worked on his immune system, his sleep, and his circadian rhythm with epitalin. So this process is how we can get you to live pain-free. It works every single time with every single patient as long as you follow this 3-phase process. Without it, your body is compromised. You may not get the results you're looking for. And so the next step for you is to reach out to our pain experts. As you come in, let them know you've watched the video. That is what we really appreciate. Thank you so much for being part of this clinic and this community. We appreciate you, and we'll see you very soon.